Hello and welcome to Sip of Wellness, the podcast where we dive headfirst into the awesome world of healthcare and wellness. Stick around as we chat about all sorts of things, one sip at a time, uncovering all the details that shape how we feel emotionally, mentally, and physically. We're joined by interviews with the experts, sharing facts that'll support you all the way and questions that'll make you think. So grab your favorite drink, find a comfy spot, and let's gulp down some wisdom. I'm Rima, and today I'm joined by none other than Dr. Giuseppe Marchesani, CTO of Bioscience. Welcome to the episode, Dr. Giuseppe.
Hi, Rima. Thank you for inviting me.
Thank you for coming. So, Dr. Giuseppe, can you explain to me a bit like what it is to be a CTO at Bioscience?
So, to be the CTO of Bioscience, it means that we invest time working on cell therapies and genomic therapies focused on regenerative medicine. My work is support to my colleague in whatever is going to be important for our clients in terms of cell therapies again and health improvement.
Okay. And when we say cell therapy, what do we mean exactly?
Cell therapy is a wide family of medical application that is exploding in the last years. So whenever we're speaking of cell therapies, we are speaking of producing and clinical use biological drugs for application that can be medical, aesthetical, or in any case connected with well-being.
Okay. And the building blocks of these therapies is, as we discussed, it's stem cells, or does it involve other things?
Of course, it can involve adult cells, it can involve stem cells, it can involve even CAR T cells, as we saw in the last year. Is something absolutely wide and absolutely interesting to study.
We've been hearing a lot about stem cells in the past few years, like it's been gaining a lot of attention, but I feel like a lot of people still do not understand exactly what stem cells are. So from your professional experience, can you explain what stem cells are in a way where people can understand actually what it is?
Absolutely, it will be a pleasure. When we are speaking of stem cells, we are speaking of a specific type of cells that we have in our body. These cells are the base of the process of regeneration of our tissues. If we think a bit over, everything about our life is starting from stem cells. The first stem cells that is giving us life is the embryo. Nothing else than the embryo at the end. So during the life and starting from the embryo, the stem cells go through a process of differentiation and, of course, build our tissue, replace our tissue, fix the damage of our tissue. So they are the base cells for our life at the end.
Okay. So they're naturally occurring in our bodies.
Absolutely. It's possible, of course, to find also synthetic stem cells. This is something that is quite new, let's say. But at the moment, whenever we're speaking of clinical application, we are speaking of stem cells that are normally present in our body. And to be more precise, when we are speaking of clinical application in the real world, so outside the research world, we are speaking of adult stem cells, the stem cells that we can isolate from our tissue, from our body, when we were just born or when we are adults.
You said initially that the stem cells basically help us from embryonic stages until we're adults.
Yeah.
So let's say today as an adult, how can I collect my stem cells, or where can I get these stem cells from personally, if we're talking directly from me?
In each of our tissue we can find stem cells, even when we are adult. If you consider, for example, your skin has a layer of stem cells that is continuously producing new skin for your body, avoiding your tissue to be degenerating. But, for example, there are two really interesting group of stem cells that we can find in our tissue when we are adults. One is the hematopoietic stem cells, the stem cells that is in charge of the regeneration of all our cells of our blood. And there is another group of cells that are the mesenchymal stem cells that are related to process of regeneration and control all the tissue that are part of our mesoderm. So basically adipose tissue, bone, cartilage, and etc.
Okay. So we have two types of stem cells we can take from adults, basically.
Absolutely. For example, we can find hematopoietic stem cells in the bone marrow, as well in the cord blood.
Okay.
And we can find mesenchymal stem cells in several tissue, including bone marrow again.
Okay.
And
So the
of
bone marrow has two, both
Absolutely.
types.
Yes.
Okay.
And it's a very fascinating this process. We will, if you like, we can also discuss a bit later.
Definitely.
And of course, we can find in the adipose tissue. We can find even in the skin.
So these stem cells, these two types of stem cells, the main purpose of harvesting them would be to use them personally for treatment? Is that what you're saying?
Absolutely. Let's be very, very direct. Which is at the end the scope to bank a product if it's not going to be useful? So both hematopoietic stem cells and mesenchymal stem cells are critically important when we are speaking of a clinical application.
Yeah.
When we are speaking of hematopoietic stem cells, we are speaking of cells that are used since 20 years for the treatment of blood cancer. When we are speaking of mesenchymal stem cells, we are speaking of cells that are used since a while for the control of autoimmune diseases, for the control of the process of degeneration of cartilage and bone-related issues, as well are cells that are going to be used continuously, daily, for process of degeneration that are involving the skin or the hair.
So if I'm to classify, let's say, the two types of stem cells and what they would treat or what they would help in, what would be the first one versus the second one? Like, what would be the different uses of them?
Hematopoietic stem cells are mainly focused on the treatment of condition like blood cancer, when mesenchymal stem cells are mainly used for the treatment of the process of degeneration of our tissues.
And when you say it's being used in oncological cases, is it being used anywhere in the world, or is it specifically used in specific places? So basically, any hospital can provide a treatment with stem cells?
It's yes or no, the correct reply. Hematopoietic stem cells are used worldwide in specialized centers for the treatment of oncological application. When we are speaking of hematopoietic stem cells in oncology, we are speaking of treatment that are very well assessed, that are very well known, and basically are worldwide offered to the patient with oncological problems. However, of course, you require specialized hospitals that will be able to follow the patient during the journey of the disease.
Dr. Marchesani, you were saying that stem cells are being used for treatments of cancers. Now, in general, most people are skeptical about the idea of using a magic wand, basically, as they call it, like stem cells as magic, like it will completely treat. However, from what I know personally is that stem cells actually are used in combination when it comes to cancers. Is that true? It's used in combination. It's not like a magic wand.
In science, we don't have anything that we can consider magic.
Okay.
So, and the true is also true in medicine. So, hematopoietic stem cells for the treatment of cancer is an important tool. Cannot be used for every patient, but is a tool that is used for several patients that otherwise will not have any other basically option of therapy. It's not the first time that we heard in our life about bone marrow transplantation. Bone marrow transplantation is nothing else than a transplantation of hematopoietic stem cells at the end.
But it was labeled as bone marrow transplantation rather than,
Yes, it's easier to speak about bone marrow transplantation instead. Also because it's interesting to know that the co-transplantation of hematopoietic stem cells and mesenchymal stem cells, so both the component of bone marrow, is rising the success rate of this kind of treatment. I want to underline one additional point that maybe can be interesting. At the moment we have, for example, a cure for HIV through hematopoietic stem cells.
That's incredible on its own.
Yes, it's quite incredible. It happened that doctors had to cure patients with HIV and also blood cancer. During this process, they have transplanted to this patient bone marrow from a donor with a specific kind of mutation that was making the donor resistant to the virus of HIV.
Okay.
So the patient that received this transplantation basically got cured from the cancer.
Yeah.
Why? Because at the end, the HIV is a kind of virus that is targeting a specific cells into the immune system. Whenever we are going to make these cells resistant to the virus itself, we can cure the disease.
Would you say that it has unlimited uses in the future, for example?
I will never say unlimited use if we want to speak scientifically, but of course, I would like to say incredible potential to use that we cannot yet predict. I want to give you another example, if you don't mind. Let's speak, for example, about the CAR T cells. CAR T cells are a product that is quite new on the market that allow the treatment of a pediatric patient affected by leukemia that is basically resistant to any other type of treatment. CAR T cells is nothing else than the cell therapy. The doctors and the biologists that work with the doctors collect the lymphocyte of the patient. They transfer inside the lymphocyte of the patient a chiral receptor, basically a synthetic receptor that will allow this lymphocyte to recognize specifically the tumor cells. And then they transfer again back to the patient T cells. Through this kind of system, we can build basically soldier specialized to kill only the tumor cells. Now, imagine what we can do starting from the hematopoietic stem cells of the patient. If in future we are going to have more option of synthetic receptors, we can take the hematopoietic stem cells, differentiate them in the type of the cells that we want. We can engineerize these cells and then treat the disease that we are looking for. Without the use of drugs, but use strictly biological product with limited side effects.
So you're saying we can take the stem cells from the human body and then, let's say, adjust the shape of these, or not the shape, the
information.
Yeah, the information of these cells so they can target specific things or so they can work against specific diseases?
This is something that is already on the market. It's something that is already done through the CAR T cells. And soon we'll see a new product like the CAR NK cells that probably will be a very important tool for the treatment of solid tumor cancer, not just blood cancer.
Because I wanted to ask you, like, we hear a lot about stem cells being used to treat diseases like blood-related disorders or blood cancers. But we always, like everyone always wonders if they can be used for solid tumors. So now you're telling me it is a potential.
It has a potential. It's something that it's now under study, but is really promising for the future application. As well, mesenchymal stem cells are tested at the moment as a driver for chemotherapy that are able to deliver the drugs specifically in the area where the tumor is located, reducing strongly the side effects that are normally connected with the chemotherapy itself.
So this applies for any cancer, not just specifically for solid or
This applies not just for cancer. When we are speaking of stem cells, we are speaking at the end of tools that can use for process of degeneration. If we consider the cancer a process of degeneration linked with mutation that our cells acquire, well, still we are speaking basically of a process of degeneration. But the concept of aging is basically a process of degeneration.
Okay. Before I jump into the regenerative aspect of stem cells, I just wanted to ask you from your knowledge, How exactly do stem cells work? Because this has been a vague question, basically.
We have to start the question with which kind of stem cells we want to speak about.
Okay.
If we are speaking of the hematopoietic stem cells, they are cells that, as we were mentioning before, are going to produce daughter cells.
Okay.
These daughter cells can have characteristics that are going to be different from the original stem cells. And when we are saying that they are going to be different, it means that they are going to be specialized in a specific kind of function.
Okay.
For example, hematopoietic stem cells are the main source of all the lymphocytes in our body, basically the soldier, all the other leukocyte population that are critically important for our, let's say, immune system protection. When we are speaking of the mesenchymal stem cells, well, we are speaking of something a bit different. We know very well that T cells are able to differentiate, but at least for my point of view, what is really interesting of T cells is the ability to modulate the environment where they are going to be injected or infused.
Okay.
When we are speaking of modulation, we are speaking of basically the release of different kind of growth factor, different kind of vesicles that are able to push the tissue to do something or push other cells to do something else. For example, mesenchymal stem cells are able to induce the vascularization of the tissue where they are injected. They are able to have an activity antifibrotic. They are able to control the immune system.
The regenerative aspect of stem cells. That is something that's been booming for the past few years. The regenerative aspect, when we talk about beauty, when we talk the aesthetic aspect, this must be a new revelation when it comes to the aesthetic part. So how does it happen from your end? Like, do you take the stem cells from the patients? Do you provide them as ready to use solutions? How does it work?
Yeah. At the moment when we are speaking of stem cells, we have to decide if we want to speak about autologous or allogenic stem cells. At the moment when we are speaking of hematopoietic stem cells, we must speak of autologous hematopoietic stem cells, or we have to work to find a perfect matching donor for the hematopoietic stem cells that will not induce a rejection. The story is totally different when we are speaking of mesenchymal stem cells. Mesenchymal stem cells don't have what I like to call the fingerprint of the cells, so the human leukocyte antigen. This kind of group of molecules that are on the surface of the cells are there to basically tell to our body what is self and what is not self.
Okay.
For some reason, mesenchymal stem cells just have partially this kind of fingerprint. So they are immunotolerated by the immune system, and we are able to use mesenchymal stem cells in autologous and an allogenic way. Whenever we are producing autologous or allogenic mesenchymal stem cells, what is going to be provided to the patient is a final product ready to be injected.
Okay.
Now, it's important to underline that any biological material is very delicate, is subjected to the temperature, is subjected to oxygen concentration. So the mesenchymal stem cells based product must be produced and released to the patient in the shorter time possible. They cannot just be stored somewhere and maybe used after more than 5 days, 6 days.
Okay.
So the product itself, as mentioned, is absolutely sophisticated and delicate. And the clinician are going to administer the product to the patient based on the need of the patient. Can be injection in the skin, can be injection in the joint, can be injection in the scalp, or can be complex process of reconstruction when we are speaking, for example, of scar tissue.
So what would be the uses at the moment of these types of stem cells?
Mesenchymal stem cells at the moment are used for the tissue degeneration, as we were mentioning. The main application are going to be related with the orthopedic application, as well for aesthetic application like skin rejuvenation, volume augmentation, scar revision, reconstructive medicine that is quite common, unfortunately, here in Dubai. For example, Botox reconstruction after the removal of the implants. And of course, they are used for well-being.
Okay.
Well-being is a critical application for the cells, especially when the patient is affected by autoimmune diseases.
So how would you know if these stem cells are actually doing you a benefit if you're using them for longevity, right? For aging? What would be the noticeable differences?
Yeah, it's going to be very interesting to monitor the patient when we are using the cells in a localized way. I like to say that localized problem must be treated locally with local injection. So, of course, whenever you are treating a scar, it's very easy to track the improvement of the scar. When we are treating the skin of the patient affected by wrinkle, it's going to be easy to monitor the wrinkle, the laxicity, or the pore of the skin of the patient. When we are speaking of well-being, is also very interesting to monitor the benefit of the patient based on the condition of the patient. Let's take the example of rheumatoid arthritis. A patient by having rheumatoid arthritis, we all have one grandfather with, is our patient that basically are going to have pain at the level of the joint. Well, when we are treating this patient, the monitor of the pain is very, very easy. So immediately we see results with the patient for the patient itself. When we are treating well-being, the concept is going to be much more complex. Why? Because it's difficult to measure subjective parameters that are not easy to, let's say, to track. Exactly. However, it's possible still to measure the pro-inflammatory cytokines in the patient, in the blood of the patient itself. So we can see how is going to be strong the impact of the stem cells.
So you check them before, after, more or less, to see what the effect.
Absolutely. It's critical to check these parameters together with other parameters like the C-reactive protein, as well, for example, the general well-being of the patient, to see how much the patient is improving.
And when you say you usually administer stem cells to the patient, do all treatments take the same method of administration, like IV or intradermal? Are they all the same?
It's very important to underline that stem cells treatment must be tailor-made for the patient need. So whenever we are, for example, discussing about skin rejuvenation, we have to assess the patient to understand which is going to be the level of damage at the skin of the patient. A 30-year-old patient is not going to be the same of a 50-year-old patient. A patient that is going to have, let's say, a skin damage by exceed sunburn is not going to be the same patient of the same scheme of a patient that is not exposed to the sun.
So it's tailor-made to the patient.
Absolutely. There are, let's say, general parameters to follow that we provide to our clinicians, but of course, at the end, the final protocol must be tailor-made as per the patient needs.
And you mentioned earlier that usually the stem cells, when injected or when administered to the patient, they have a line of formation, or they can develop into other types of cells, right? Differentiated cells. Now, does that happen before they're administered to the patient, like in the lab, or after? Like, does the stem cell, once administered, know how or what to do, or is it usually done beforehand?
Actually, we trust in bioscience in the use of not differentiated cells. Also because it's very difficult to have physiological proof of the differentiation of T cells in vivo. What I mean, that until now, there are no clear scientific data that are going to prove that mesenchymal stem cells are differentiating in fat, in bone, or in cartilage. What we know for sure is that the T cells are going to release a quantity of growth factors, cytokines, and other molecules able to condition, help, support the process of regeneration of our body. The differentiation in vitro of the cells is absolutely possible. However, whenever you are going to differentiate the cells, you are reducing the power of the cells itself. So we have to decide if this concept is going to be really interesting for the patient or no. For this reason, we don't absolutely induce any kind of differentiation to the cells before administer the cells to the patient.
So let's say someone just wants to feel better and wants their skin to look better and all of that. Would an injection, let's say, I don't know how it works, but would an injection of stem cells actually help them overall?
An administration of cells can, of course, help the patient in the well-being. The protocol of the administration, localized or systemic, must be decided with the doctor based on the needs, conditions, expectation of the patient itself.
Let's say someone wants to use it. They can use it overall. Like the stem cells will automatically, once infused, they will kind of know what to target and they will kind of fix as they go. Is that correct? Or am I jumping too far?
No, it's partially correct. What is happening is that the stem cells, when infused to the patient, are going to reply to the environment. So mesenchymal stem cells injected in a tissue that is subjected to high level of inflammation, like, for example, the joint of a patient affected by osteoarthritis, start to produce growth factor that will reduce the inflammation and will support the process of healing of the patient. At the same time, whenever we are going to inject mesenchymal stem cells in the skin of the patient, where there is a lack of oxygen, a lack of nutrient, the cells will induce the angiogenesis, so the growing of new blood vessels in the tissue of the patient. And this is going to provide nutrition to the fibroblasts that will produce the collagen and we reduce the wrinkles. So that is something that at the end we want.
Definitely, everyone wants that. Which brings me to my to this question. If we're talking about the rejuvenation aspect of stem cells, a lot of people go for interventions when they want to fight wrinkles. So most people go for fillers or for Botox or these things. Can we say that stem cells can actually be on that same...
Until now, we focus the aesthetic medicine on processes that are going to, in somehow, fill gaps, but are not going to boost the health of our tissue itself.
Okay.
What we are trying to do with the process of regenerative medicine is literally to change the tissue itself, allowing the tissue to produce the same kind of molecules, the same kind of cells activity of when we were younger.
Okay.
So a good prevention, a good support of the tissue will, of course, reduce the potential risk of wrinkles and related aging process.
Okay.
Is really important to underline that any kind of anti-aging therapy is not just cannot just be interventional, but must be absolutely a process of control. So we have to take care of our aging process since when we are young, if we want to age well.
Okay. So when you say when we are young, when would be an age where it's advised to use stem cells to prevent aging? Not prevent, to age gracefully, I would say.
It is another really interesting question. We know that starting from 2025, the quantity of circulating mesenchymal stem cells is drastically dropping. So I would like to say that the stem cells can be used in any moment of the life. However, I will consider the use of stem cells when the physiological quantity of our stem cells will start to be lower.
Okay. Would you say there are anything hindering the multiple use of stem cell infusions? Like, let's say someone wants to use it continuously, starting a very young age. Is it something that has to be done multiple times, or is it something that you do once? How does it usually go? Let's talk specifically about aesthetic purposes.
The anti-aging, as we were mentioning before, is not just one event that we take care one time in the life. Whenever we are trying to slow down the process of aging, we have to repeat the treatments in a let's say, organized way under the control of a physician that will follow and monitor our progression and will adapt the therapy that we were mentioning before based on the condition that we are living. A person that is having a very stressful moment in the life is going to require more attention than a person that is in a good phase of the life without high level of stress, for example.
This is so interesting. The possibilities of stem cells to be used in life are so vast. What do you expect in the next couple of years, or in the next, let's say, 5 to 10 years, for stem cells to be able to treat?
In my opinion, what is going to really change in the next of a couple of years is the integration of the stem cells, and not only stem cells, several biological products in the medical routine. Until now, these products are considered quite an elite products used by a restricted group of population that are, let's say, in touch with doctors that are quite unique in their kind. I quite sure that finally we are going to spread the use of this kind of product much, much more. And what we will assist in the next year is the integration of this kind of product in the daily routine of our medical treatments.
I actually wanted to know more about the applications of stem cells, not in terms of what they treat, but how they can be used. So you mentioned that they can be used as infusion. Is there any other way where we can use stem cells and get a benefit out of them, not through IV?
Yes, of course. IV treatment are a restricted kind of application that are mainly focusing on systemic conditions. Or as well, for example, in the case of the hematopoietic stem cells, in the repopulation of the bone marrow with germline cells. However, whenever we are going to have a localized problem, it's important to use the cells locally. So whenever I'm going to have a localized problem, for example, connected with the skin rejuvenation, I'm going to inject the cells directly in the skin. I will never infuse the cells in this case because the concentration of the cells in the target area will be difficult to achieve if I'm going to work systemically. As well, if I'm going to have osteoarthritis, so the typical joint pain, I will inject the cells in the joint.
Directly into the joint. Okay. Whenever I hear about stem cells, like, I can't help but wonder how extraordinary they are. But one of the things that is always on my mind is, why do we not hear more about them? You're saying, like, everything that you're saying and everything that we read shows how much potential they have. Yet we don't hear about them that often. What do you think that the reason behind that is?
In my opinion, there are several factors. Some factors are connected with the cultural point of view. Not, as we're mentioning, there are no everywhere in the world specialized center, specialized doctor in the use of stem cells. You need to have an expertise. The integration of the biology in the medicine is something quite recent that is actively done just in the last 7 to 8 years. So sometimes it's difficult to find a specialist able to use this kind of product. The second key point is related with the regulation itself.
Not here, not just here, you mean in the world?
Everywhere. It's really important to analyze the regulation of the country. For example, the UAE allow the use of mesenchymal stem cells after deep revision of the MOH and the local authority, the Dubai Healthcare Authority. So this is going to give a level of safety that is going to be, but at the same time is going to give the possibility to the final client to have advanced product. Whenever we are looking into other country, this kind of regulation are not always very clear.
Okay.
And so it is a huge advantage here in the United Arab Emirates. The third point is the expertise. The production, the banking, the release, the quality control related with this kind of cells is very tricky. So require high level of expertise that is very difficult to find around the world, and require big investment in terms of production. Again, we are speaking of tailor-made therapy for the patient itself. However, I'm sure that also this kind of limitation is going to be, let's say, adjusted, fixed in the next year when we are going to have a better expertise, a better training all around the world regarding these products.
So you see within the next few years, something like this might happen. We might reach a point where stem cell therapy is accessible to everyone.
I think absolutely yes. There are technology that are reducing the cost. There are program of education that are absolutely also very important, that are focusing on the production of this product, that are not, when we are speaking of drug now, we don't speak more of chemical based production, but finally we speak about also biological product to be used for a clinical application.
I've been hearing recently about plant-based products, like plant-based stem cells or plant-based other biological products. Now, does it work the same way humans' stem cells work? Or, for example, animal stem cells, does it also work? Or is it specifically humans that we need to work with?
This is a really tricky question, and sorry if I feel a bit, let's say, humoristic, if you want to say. Animal stem cells, plant stem cells, at the moment cannot be used for clinical application.
Okay.
The reason is very, very simple. The way human stem cells communicate is totally different from the way plants cells communicate.
Okay.
Maybe we can have a few molecules that are similar, but our evolutionary tree divided several millions of years ago, so we totally different species. When we're speaking of animal products, actually we are also speaking of fingerprint that are totally different from the one of humans. So you will never be able to use normal animal cells for human use. There are some research in the US regarding the engineerization of animals to make sure that they are not going to express any kind of fingerprint, what we were speaking about before.
To engineer the animal to not express. Okay, that's actually very cool.
Yeah, it's very, very cool. And they've invested, the research have invested a lot in this kind of project. Why? Because through the animals, we can, through this kind of special engineered animal, we can theoretically produce organs as spare parts for our body. However, until now we never were successful, not in the engineerization of the animal, but we always failed in the transplantation of the tissue.
Okay.
Why? Because the patient that have received organs from animals, unfortunately, had suffered infection that were typical of the animals.
Okay.
And that we were not aware of. So until now, we are not able to totally control the biological risk used with connected with the use of animal products.
Okay, so definitely stay away from animal products.
Yeah.
Okay, that's comforting to know. But when we talk about stem cells from humans, I hear here and there that we might be able in the future to make an organ out of just stem cells. Is that something that you think would be doable?
Of course, there are progression also on this direction. It's something that will still take a long time for the basic reason that we have not yet aware of the way to educate the cells to do what we want that they will do.
Okay.
So it's going to be really, really complex.
But theoretically, it's possible.
Theoretically, it's possible. There are groups that are working on this direction. It is absolutely interesting.
Okay.
It's going to be something that at the moment is going to be a bit far, on my point of view, because it's really technically complex to work in three dimension, to work with multiple kind of cells, to work in a condition that will allow us to have a full functional organs to be transplanted in the patient.
Okay. I also heard recently that a patient with diabetes, I think type 2 diabetes, was fully treated with stem cells. Like diabetes is a kind of disease that is very widespread between people. So this alone opens a huge channel for treatments. Now with diabetes, I don't know what your experience is with diabetic patients, but do you think we might reach a point in the future where we can fully treat diabetic patients and hypertensive patients?
Potentially, yes. Until now, we have not seen any real success on this kind of treatment. This is a point that I like to underline. Unfortunately, at the moment, we don't have clinical application, effective clinical application using stem cells for the treatment of Parkinson, Alzheimer, autism, or diabetes too.
Okay.
At the moment, we have a therapy that can support this kind of patients for, let's say, the quality of the life concept.
Okay.
We know that the administration of mesenchymal stem cells can reduce the needs of insulin in diabetes to patient, but at the moment it doesn't exist a cure for diabetes using stem cells.
There are clinical trials, I think, at the moment being done on all of these diseases that you mentioned, or most of them, which also shows, which also makes it possible to have hope for the future.
Absolutely. We must have hope for the future. The point is that we have to be always very ethical with our patients. So whenever we are speaking of treatments, we are speaking also of hope.
Okay.
And it's not nice, it's not ethical correct to provide to this patient hope that is not going to be related to scientific data.
One of the things, actually, doctor, that I usually say is that stem cells have the potential to treat anything in the future. Now, I know this is a bit of a broad or a generalized term, but do you think in the future, distant future, we might reach a point where stem cells can actually fully replace medicine and treat everything?
I always think that stem cells in the future will be a critical tool for the medicine. But I really never think that, and I'm all my life at the moment is based on research in stem cells. I never think that one treatment will be fine for everything. There is so much that is going on in medicine that will be in somehow limited to speak only of stem cells. And I wish that we are not going to have just stem cells. Because of course it's the biology, the medicine, the research is so wide that I cannot wait to see what is going to give us.
That's amazing. I'm very excited about the future, because the ideas that are there, that when I talk to people like yourself, I feel very hopeful about the future. What I wanted to ask was, you've spent a large portion of your life studying stem cells, and you've also mentioned that you've been involved in the uses and treatments related to stem cells. So can you tell me from your experience if you have any patient that comes to your mind when we talk about stem cells that you actually were able to properly see effects of stem cells on?
Of course, the patient that I will, let's say, keep in my heart more than in my mind are the patients with medical conditions, patients that were suffering a condition that were limiting their life. I have in mind the patients that were treated for orthopedic condition, rheumatoid diseases in young age that were not able to do a normal life. Or recently, I was speaking with one of our doctor regarding a patient that was having problem with the thyroid, and after the use of the cells, let's say the thyroid was able to acquire partially the activity of a normal patient. And we are speaking in this case of young patients. To associate something, let's say, really useful for the patient in their daily life with all the years that you have spent studying is always something very nice for me.
Thank you so much, Doctor, for sharing your experience with us. It's really been an absolute pleasure. Can I know, for anyone who's watching us, if they want to come and see you and take more from your expertise, where can they find you?
They can find me online, of course, through my company, Bioscience. They can contact me in the social media. They will find me on Instagram, no problem at all.
And you do consultations for...
I'm a biologist, so I don't do consultation. So, but I will be very happy to discuss whatever is going to be related with the science behind the stem cells, to show to anyone what we do and how we do.
Thank you so much for your time. It's been an absolute pleasure.
My pleasure. Thank you.
Thank you. Thank you so much for joining us today. Make sure to subscribe to our channel, and whatever topic comes to your mind, make sure to mention it in the comment. Thank you, and see you next time.